Breast augmentation is a procedure that is used to enhance the breast, often for changes that are either due to genetics, meaning a lifelong lack of breast tissue, or the changes of pregnancy or motherhood that can often render the breast smaller or insufficient in certain areas of the breast, particularly in the upper pole of the breast, where often after breastfeeding and having children, a woman can lose volume in her breasts. There are two main types of breast implants that are available today. There are saline implants and silicone implants. Until about 2.5 or 3 years ago, the only implants that were widely available were saline implants. Until in 2007, the Food and Drug Administration reapproved silicone gel breast implants for use in cosmetic surgery. These silicone implants are different from the silicone implants that we knew 20 or 30 years ago in that they're cohesive gel implants. Sometimes these implants are erroneously referred to as a gummy bear implant, which is a commonly used term to describe the gummy consistency of the implant itself. But what it really refers to is the cross-linking of the gel of the implant that creates an implant that, when it's cut in half with scissors or a knife, retains its shape and its form. Although these implants are soft and have much the cohesive consistency of breast tissue themselves. Currently today, silicone implants tend to be a more common implant that many patients, at least in my practice, will choose to employ in augmenting their breast or enhancing their breast, mainly because they feel and look to a certain degree a little bit more like breast tissues. Cup size is a challenging terminology to speak of when we talk about breast augmentation or breast enhancement surgery, and the reason is because cup size, as we all know, isn't standardized across bra manufacturers. If you shop at one department store versus another boutique store, you may be an A cup at one and a B at another, and yet a C at another manufacturer. And so cup size we talk about when we talk about breast enhancement in the context of allowing us to have a language that we speak that's the same with the patient. In other words, understanding what the patient thinks her cup size is and where she would like to end up is probably as important as knowing what her actual cup size is. From that, it's difficult to go up, in my opinion, by more than 1 to 2 cup sizes in a single operation. Certainly there are patients who will experience more change than that, but going up by more than 2 cup sizes is a little challenging in a single operation. The best candidates for breast augmentation would be patients who either have a lifelong absence of significant breast tissue, in other words, a woman who since adolescence and since development has always had a smaller breast and just desires to feel more feminine. Likewise, women who have had children and who have experienced the changes of pregnancy that can often occur. And for mothers in particular, we see that breastfeeding and motherhood can often render the breast with a loss of volume, particularly in the upper pole of the breast, where the upper pole of the breast can look more scalloped, can lose a little bit of volume, and it can lead to just a defeminizing appearance of the breast. Many women are not interested in having a breast that passersby on the street would notice that she's had surgery or had a breast enhancement procedure. Most women really just want to feel feminine. They want to be able to wear clothing, wear a bathing suit, and be able to restore that sense of femininity that's either been lost by the changes with hormones in pregnancy or just due to nature itself and not having a significant amount of breast tissue since development.